Welcome to the Transforming Healthcare Coaching Podcast, where we're all about helping healthcare professionals like you create positive change at work, at home, and everywhere in between. Hi, everyone. Welcome to the Transforming Healthcare Coaching Podcast. And this week, we're going to talk about truth, trust, and talking about science. Why it's really hard to communicate in a very skeptical world. And I'm really honored to have my friend and colleague, Dr. Varun Shetty, here with us. He is a pediatrician and intensivist and global health leader. And I want to just say thank you so much for coming on the podcast and let you introduce yourself.
Thank you so much, Lilly. It is such a pleasure to be here and to be talking about this. Yes, I am an adult intensivist. I do work in Cleveland, and my opinions are my own in this podcast. They don't reflect my employer. I am also a trained pediatrician, and I wrote a review article on vaccines, on the rationale for the immunization schedule, when I encountered my first vaccine hesitant parent while taking care of a patient. So that's when my interest in this began, and that's how far it goes. So I'm excited to be talking about this.
Awesome. Thank you so much.
Yeah.
So I'm wondering, what are the biggest gaps in perception between healthcare providers and patients when it comes to vaccines and medical misinformation?
Yeah, I think, it's important first, I want to frame the problem, right? We've always had vaccine hesitancy, but it took on a new scale after COVID, where even people who believed in childhood vaccinations like measles, mumps, rubella were skeptical of the COVID vaccine. So I was interested in looking at this post-COVID literature. And one of the papers that came out was by Natalie Purcell et al. In BMC. It was called When Clinicians and Patients Disagree on Vaccination. And they looked at perception gaps by surveys between patients and physicians. And one of the biggest perception gaps was that patients just did not think they had enough information on vaccines. And we as physicians always think we're providing all the necessary information, but that was not what they were seeing on their end. There is other data, other literature that also talks about how providing leaflets regarding vaccine information, or pamphlets, if you want to call it that, is received better by patients. So I think that is also addressing that sort of knowledge hunger, so to speak, that patients often tend to have. And so that was one of the biggest gaps that I saw. On the side of physicians, they often thought that a lot of their vaccine hesitant patients were not going to the right sources. But a lot of the patients that were surveyed said they did believe in trials, and they did believe in clinical trials and scientific information. So I wonder, after reading this paper, is the problem in accessing that information? Not quite the belief in science, but more about the trust in the individual provider, the kind of noise that social media provides, the gaps in science. There was also one of the perception gaps was patients did not feel heard when they had genuine issues with vaccines. So to address that head on would be important, right? To say that nothing in this world is risk-free and is perfect. And vaccines do have risks, but the benefits of vaccines far outweigh the risks. And we have a system to track vaccine side effects. So I think those were some of the biggest perception gaps that I found in my review of literature.
Yeah, that makes sense. That part of it is there's so much noise and there's so much conversation, and you don't really know who to believe. I mean, there's no reason why a particular physician or clinician or a nurse influencer who will give out information in whatever format, social media, advertising, webinars, local information given out at regional clinics in your city to get out public health, and then also accessibility of that information. In terms of lots of people are just working. They're really busy. They really don't have time to be trying to consume all of their news. And so all they see are these flamboyant headlines on the news or these strange little ads that pop up on your phone. And they believe it because, I mean, they were advertising for some kind of supplement or advertising for it, underlying other motive. And so they don't really have time to sift through the amount of data that's out there. I mean, physicians, and even in our training, the exponential growth of information that's out there, even for us to consume, is a huge now. And so I think we're all a little bit excited to be able to have AI and other ways to filter and screen and continue all of us asking better questions. So I think the best thing about AI has been we're all asking more questions now to try to drill
Yeah.
down to get the right information. And so I'm wondering, let's first tackle the knowledge piece. How can we help everyone get better information?
Yeah, I think that's the core of the issue, right? How do we trust the source and how do we find a reliable source of information? And I think it's important to remember one, that all sources of information are not equal, even if they sound confident, maybe especially if they sound confident. And your physician in the specialty of practice. So, for example, if you want to learn about vaccines, childhood vaccines, and childhood preventative care, you don't want to hear an anesthesiologist talk about it. You don't want to hear an adult cardiologist talk about it. You want to go to a pediatrician or a pediatric allied specialty. And that would be the better source of information. Second, hierarchy of information. One physician is good. Consensus among physicians and scientists is even better. So there are organizations that will put out guidelines on medical care and they will put out consensus guidelines. And that's what you want to look for is what are the consensus guidelines? For example, what does the American Academy of Pediatricians, which brings together vaccine scientists, physicians, clinicians, and nurses, them all together in one room where they look at the literature, where they're sifting through bad literature, good literature, and then coming up with recommendations. What are they saying? And that would be the most reliable information. I think part of what happened as I was going through, and Lily, I would love to hear your thoughts on this too, as an intensivist, was during COVID, because it was a new disease, none of us really knew what the right answer was in the beginning. So there was this gap in information and there was this widespread fear. And science takes time to sort things out. And you will hear good scientists, good physicians always say they don't know when they don't know. They will not fill in the gaps with information that is untrue. Well, and I think that probably damaged some of the trust and credibility that people have in scientific organizations. But we must also remember that was an unusual time. It was a pandemic with a brand new disease, and it took us a moment to find our bearings. But now we have really good evidence for COVID management. We have really good evidence in support of COVID vaccines. So it took its time, but we got there and it's working. So that is some of the ways I would say that people can find the right source of information.
Yeah, I think it's interesting you say that perhaps it was the unknowns of the COVID pandemic that caused generalized mistrust of science and clinical treatment recommendations, simply because treatment recommendations did change in the first 2 years over time as the virus changed and the host virus
Mhm.
interplay changed. And what we mean by that for people is the fact that while the virus and the way it appears inside each unique individual human is different, also our treatments were trying to catch up in terms of how
Mm,
we could support. So a lot of times in critical care, especially a lot of the things that happen in terms of supporting infections and people's recovery is what we call supportive care, meaning try to make sure you're moving as much as you can, as much as your energy can tolerate, giving you as best nutrition as we can think is possible, and also giving you enough oxygen to be able to let your body to do what it needs to do. And that supportive care really, the question is in what timing, what interval changed over the first couple years of the pandemic with the COVID in particular. It wasn't that we didn't necessarily know. We knew how to do
right.
supportive care. It's
Right.
just that we didn't have a magic bullet of a drug to
Right.
cure something that is a viral illness, which, as we all know, every single viral illness is going to run its course. Once you have it, the reason you die is because your body is not able to mount that relationship with clearing the virus and the damage to your own body. And each person, each individual is unique. And so I can see how it might feel that we couldn't fix or cure things. And I think that's the strange relationship I think we have in terms of our hopes and wishes with what the healthcare institutions and care can provide, what's realistic, and also how much we all each have in our own agency, too. I don't think any of us think that people, their families, their pre-existing circumstances, they all play effect, how we respond to our well-being,
Right.
our health, and our sickness.
And our own biases too, our own biases, our own political inclinations, our own sources of information, our own algorithms nowadays in social media, what bubbles we find ourselves in. All of those things influence how we think about science and how we consume that information.
Yes, that's really true. And I think that's the hardest thing I feel that's so sad about all of these algorithms that all of us, more and more just want to hear like-minded ideas and agree and go rah rah, the yay. I mean, I'm with other people who really agree with me, and that we don't know what it's like to be uncomfortable anymore. And I hope they
Right.
still teach, I hope a early childhood education person can tell me if they still teach debate in middle school and high school,
Right.
because healthy discourse is like, we
Yes.
actually all need to take the pro and the con. And for most of our healthcare conferences, there are pro con
Right.
debates for every major guideline, for every major paper, because we all like to think things through. Nobody,
Right.
even though the recommendations are generally in one way, we all know that these will get updated and people will continue to do work and there'll be continued investigations. We know this is just at this moment in time in 1919 versus 2021 versus 2025. It is going to change. Some things will still remain true. Some things may have more strength and some things may actually be slightly decreased
Right.
because of continued discourse. And I think that's the challenging thing, is to continue the discourse.
And I'm so glad you brought that up because I want our viewers to know, people who are not in medicine, that of how much Journal Club is part of our day-to-day lives. And what we mean by Journal Club is whenever there is a new trial, new big trial that comes out that we think may or may not be practice changing, we talk about it. We dive into the data, we talk about the modeling, and we see if it's applicable to our population or not. This is an iterative process, happens over and over again across multiple institutions. So there is a lot of engagement with literature, and it is not just so simple as whether we trust clinical trial that comes out or no. We are also vetting it as professionals, and we're doing it across the board, and multiple physicians are doing it all the time. And I think people need to understand that that level of vetting does not happen or happen outside of this milieu nearly as much as we would think that it should.
And I think so then in terms of getting into the next part that you brought up was about how we communicate with our patients and how they felt not supported or not
Right.
respected in some way when they brought up questions. I think what's interesting is when certain clinicians generationally, I think it's a generational difference. We have 5 generations working the workforce now in terms of comfort and normalcy of being
Mhm.
questioned, I suppose, as a healthcare intelligence figure. The reality is now we are only one healthcare intelligence figure. There's also ChatGPT or Dr. Google. And as much as it can make us upset, the reality is we have great new things like
Right.
open evidence,
Right.
places to be able to summarize things. And then the question is, do we even just believe the robot without
Right.
without actually checking it ourselves?
Right.
So I guess I'm wondering how is in that communication piece that we might be able to think where some of the missteps of communication might have been between the patients,
Yeah.
their families, and ourselves as a clinical team.
Oh my God. Where do I begin? So I think one, I always like to look at myself first, keep my emotions in check, make sure that I am not in the wrong, make sure that I am listening to my patient in front of me. When it comes to a vaccine hesitant patient, be it for their child or for themselves, I think what's important to recognize is that both me as the clinician or you as a clinician and the patient have the same goal, is the child's health and the child's or the person's health and prevention from disease, right? So I think I would begin there, that I am so glad that you're here in the office today or that you're here to see us and that you're so engaged in making sure that your child is safe and healthy, right? And what I then try to do is, what are the points of skepticism and where are they coming from? And I'm trying to figure out where on that spectrum they are. Are they complete deniers? Are they advocates? Are they on the pro vaccine but skeptical about this? So I'm trying to figure that out because that would shape our conversation. Then I'm asking a lot of questions. I want to know where they got that information from. And if I am not familiar with that source of information, be it a blog, be it a research paper, be it a journal article, then I would ask for that information. I would ask them to share that with me. And I want to go over that information So depending on how that visit goes, and these are AAP guidelines also, is that if somebody is really skeptical about vaccines, you keep that conversation going. And because your idea is to build trust. And if they don't trust you, if they're not feeling heard, why would they trust you? So it is important to listen to them, what their source of information is, and then go from there. And we'd be surprised how much we would learn and how far we can get just with that. That's one part of it. But once we are past that, once we have a trusting relationship, there are certain communication guidelines that come up in literature over and over again that are helpful. One of the most common things is presumptive language. So when children come to clinic, when parents come to bring children to clinic, you don't ask, do you want the vaccine? You say, they are due for these vaccines, so they're going to get these. Do you have any questions? And they have the right to ask whatever questions they want, whatever misgivings they have. But this way, we are normalizing the fact that vaccines are safe, which is an established scientific fact. We are normalizing the fact that multiple physicians, scientists across the world have vetted the safety of the vaccines, the timing of the vaccines, and are constantly looking at the evidence to determine if any changes need to be made to the vaccination schedule. And that's where this communication is happening. We have that context behind us. So talk about it in presumptive language and make sure they understand. Make sure we're speaking the same language also. For example, stroke might mean different things to different people. So making sure we have the same vocabulary and we are understanding what they are saying. So I think that those are some of the other strategies we can use. Some of the other things that come up in literature was also that I did not know this in the beginning was numerical versus verbal quantifiers of risk. For example, saying number needed to treat, for example, you need like 33 people need to be given this medication for one person to get benefit, does not work nearly as well as relative risk. This is a 50% reduction. Talking about, and more than that, talking in terms of expressing probabilities out of 100 or one. So 1 in 100 people will get this, or 1 in 50 people will benefit from this. So framing those numbers are more effective than some other statistical indicators. So some of those little tools that we can use to better improve patient understanding of what we are talking about and better understanding of patient risk. And Lilly, I want to tell the viewers that you are one of the crucial people who taught me how to talk to patients when it comes to end-of-life goals. And this is what we do also is this shared decision making, where we are trying to understand people's views and we are trying to come to them with our medical knowledge and trying to translate that medical knowledge so that they know what's in store, what's ahead, and they make an informed decision. Now,
Those are really all such great points. So many pearls to unpack there in terms of it's hard for any of us to really understand risk and to name that risk and to then practice saying that, I think is really challenging, especially because, like you said, the number needed to treat is how we sit and analyze during our journal clubs, but then how you translate that into really simple language that a 10-year-old will understand, right? So when we think about fifth grade literacy, that's really what we're trying to simplify it down to. And I think we all have to practice trying to get it so simplified that everybody will understand, especially a kid. Because if the kid themselves can understand, then that's another really good reason that we all sort of can feel comfortable about this. It's that simple.
And that's absolutely right. And for that to happen, we need to understand the literature ourselves. So numeracy that our colleague Burton Lee talks about, the intensivist who's at NIH, is so important that we as physicians, as healthcare providers, need to constantly work on our numeracy, our understanding of statistical facts and figures that come up in the literature so that we can better translate it for our patients.
Yeah. It's really hard though too sometimes. These are really amazing things that you're describing, the fact that we have to check our own emotions first. We have to really get curious and understand what's most important to each person. And I think also just naming and acknowledging that it is really nerve-wracking to take a vaccine. Like people hear all kinds of stories. And even if it's 1 in a million, it's still scary to hear the 1 in a million. And just to acknowledge that and then try to figure out, well, what will work for their cognitive decision-making processes that might help, because we're all making decisions based on a little bit of emotion, a little bit of tradition, right? And then also a little bit of new knowledge and just making sure
Right.
that we have the understanding. So it's that mix, that interplay. So I think the other problem is a lot of traditional fact-based approaches to debunking the misinformation that's already out there. Because some people are pretty well
Yeah.
believing in the misinformation. They're like, I've believed it for 5 years now, and I don't see anything otherwise. And other doctors just sort of back off when I say all these things. So our traditional methods sort of fail in how we have the conversation for completely false information. That's an even bigger problem, I think, than
Right.
doing it right in the first way, right? I think a lot of
Right.
people have really great experience with honoring diversity of opinion, honoring diversity of perspective, really meeting people where they are. So there's lots of great examples of what you already described, the way we should do it. I think there's also a lot of us who have experienced people who've been tainted by really bad experiences
Mhm.
both ways. And
Right.
so how do we deal with that?
Yeah. It's hard, right? When somebody's very mistrustful, my first goal is to build trust. So I am not trying to convince them of literature that I am convinced of in the first go. All I'm trying to do is listen and trying to build trust and trying to make sure this person comes back to me, trusts me enough to come back to me to get treatment. And I start from there and we build it over time. We go and maybe find a moment where they are willing to share their sources of information, look at those sources and ask them if they're willing to come back to just talk about the source of information to see where we are at. And would you be willing, like how we ask permission, would you be willing to talk about these sources of information so we can have an informed discussion? Because I and you both want you to be healthy. We just have different ways of approaching it and we just have different perspectives. And I'm hoping that if we look at those sources together, we might find some common ground, that we might come closer together. So I think that trust, and this is also in the literature where patients do trust physicians, they do trust that authority figure, but they also don't want to be judged and they don't always feel like they're heard. So I think that's where we begin and know that some of this misinformation induced resistance has happened over time. So it's not going to change overnight. So we need to give it time for us to break through misinformation and then build trust and make sure they're listening to us. But I also always think, did I get anything wrong? Right? Go back to
Mhm.
my literature.
Right.
Don't just be so certain that you are right. Go back to the literature and make sure that we are doing the right thing, that we're advising the right things, that make sure the guidelines haven't changed. See what the guideline based recommendation is. It based on weak evidence or is it based on strong evidence? And does it apply to my patient? And go from there.
Yeah. I really love that because I do think that our patients, we always say as healthcare professionals that our patients are the reason why we show up every day. We learn from
Right.
them so much, whether it be our own internal ways of being able to help people better. And also, it helps push us to be able to help a greater diversity of situations better. And so we always say this. I mean, if you look at any kind of podcast or book, every healthcare clinician is probably one common theme is that our patients make us better and that relationship
Yeah.
is one of the more important things. And so what I'm hearing you say is that even when you really truly believe the misinformation, getting curious and really understanding and regaining and continuing the relationship, but we still want to be together. And
Right.
so how are we going to make this work? If we even have different things that are potentially different values, different things that are important and different ways we get information and what we think is true. Which leads me to what I wonder is why is everything so black and white these days? The reality is both are true,
Right.
right?
Right.
In terms of can we think, and I sometimes challenge people when the conversation starts to get really circular, can we acknowledge that maybe both of us are right in this room? And I'm wondering how does that work?
Yeah, and I think part of that would be situation dependent. What are we exactly talking about? Because sometimes people would say, "Oh, pharma companies, are focused on the money, and ergo this vaccine doesn't work." But there's a disconnect there. Yeah, we do know pharma companies are focused on money, but we also know that some of the vaccines they produce are super effective. I try to help frame saying that it is a constant tug of war between healthcare providers who want to do good to the patients, pharma companies that produce drugs that are good, but sometimes drugs that don't work. And that's where clinical trials and understanding and reviewing clinical trials and the FDA that actually looks at patient level data for all of these trials before approving drugs and vaccines comes into play. So we have big systems, we have lots of checks and balances to keep the greed in check. And it's important to move away from that black and white mentality and to talk about why the FDA is important. What is the kind of work it does? And why these organizations like American Academy of Pediatrics or the ACP, American College of Physicians, are important because they are our checks and they produce consensus, high quality guidelines that help us help patients.
It's interesting you say that because I also will say that we don't really know what it's like until we walk 1 mile in somebody else's shoes. And as much as many people have this belief that pharma are inherently evil in some way, I also know people who work for some
Right.
of the vaccine creation. And I would say that if you thought a physician working in the COVID ICU like you and I were the exhausted people, it actually were the vaccine
Yeah.
trialists.
Right.
Those people who across the world were trying to figure out a solution to begin to protect with some kind of immunity
Right.
to an unknown vaccine, they never slept. And they
Right.
were very mission driven.
Right.
Having spoken to some of the frontline, they're never going to be famous. They're just a person working inside the company. They don't really see it about money. They actually saw it
Right.
about we need to save everyone's lives.
Right.
And so I think until we walk a mile in somebody else's shoes, we probably shouldn't impugn their motives. And I
Absolutely.
think vice versa. In the same time, I think it's really valuable that someone wants to be really informed before they inject something. I mean, even myself, I was scared for the vaccine. Like,
Right.
I mean, I don't know, should I? But I sat and read the papers again and again. And when the data accumulated to enough where I felt
Right.
comfortable, you pull the trigger. And so
Right.
I hope that we all can see that we're in this conversation, this learning piece where we're all going to figure out what's going to be okay for us. And this is going to be different thresholds for different people.
Mm-hmm.
The most important thing is to not make it now an emotional problem rather than a knowledge problem.
I think that's absolutely right because even during the pandemic, when we were all starved for information and starved for new treatments, I think people forget the incredible research engine that the United States and the UK and so many places in the world have. All research stopped. Everything stopped in its tracks and turned to finding a solution to COVID, either trial, be it treatments, drugs, vaccines. And there was so much that didn't work, so much that didn't work. And finally, we got these vaccines that are probably one of the most effective treatments medicine has ever produced. And I ask people sometimes, do you believe in MMR vaccine or polio vaccine? And many of them who are COVID vaccine skeptics do. And I say, those trials had only hundreds of people in their vaccine trials. Pfizer alone had over 20,000 people in its trial, and Moderna alone had only over 20,000 people in its mRNA trial. And that kind of data, we were so starved for it. And to see such high quality data come out of such crisis is incredible. And it is a testament to modern medicine, and it is a testament to people's will and to people's mission to find good treatments for people. So I think it's really important for us to remember that how we actually persevered through something so terrible.
Yeah, so true. And I'm wondering as we come to a close, whether you have any positive stories or examples that we can think through in terms of how this interweaving of both the emotions and the knowledge acquisition for very polar opposite, potentially walking to the room, very polar opposite perspectives might get resolved. I don't know if you have any examples of how
Yeah.
sometimes a disinformation or a vaccine hesitant person has a good ending to what we're talking about.
There are many. And I think I want to come back to trust, that building that trust between you and your patient is the most important. When that happens, when that individual connection happens, all of the other stuff will melt away and they will listen to what you have to say. It's an incredible privilege. It's an incredible power. So it is important for us to have the responsibility to be updated on evidence, to be facile with numeracy, to kind of understand the data that we are reading, and to be able to translate that using well-known communication strategies to translate that for patients and to make sure that they are heard and they get the information that they're looking for and they make an informed decision. And that is the best we can do. And that is all we can do. I think that is most of what we can do. I think there's more we can do in terms of policy, but from at an individual level in that visit, that is what we can do.
That's a really great perspective. And I really do think that every single person can make a difference, because even in one locus of control you think is just your patients. I mean, it's just a moderate sized practice or a very large practice. And then you go out, you talk to your friends, you actually do change their opinion as well.
Yes.
And so for those pediatricians out there and many other people now currently dealing with many outbreaks across the country, we see you, and we hope that everyone can do their part. As a part of also with us at Transforming Healthcare Coaching, we do believe in the individual power, which is why we want to empower all frontline clinicians to become the best versions of themselves through the power of coaching. And through disseminating information that's really important to our regular practice. And we really appreciate your coming on, Dr. Shetty, to be able to share some really sensitive topics. This is really challenging for most people to think through and get expertise and begin to try to figure out, well, where do I even begin to become a better advocate for not only my well-being, but everyone that come into our universe in terms of our friends, our families, our communities, and our patients.
Thank you so much for having me on. It's always a pleasure to talk to you. So thank you for inviting me. I had a great time. Thanks, Dr. Amla.
Thank you so much. And so everyone, for those of you who are listening, thank you so much for listening to the end for the Transforming Healthcare Coaching podcast. Feel free to email us at podcast@transforminghealthcarecoaching.com for any other new topics you want us to cover. And more importantly, like, share, and subscribe. And please comment below if you have any thoughts. Thanks so much for listening. If you found value in today's episode, please subscribe and share with a colleague who would benefit. Together, we can transform healthcare one person at a time. Find us anywhere you find your podcasts. Ready to take your healthcare leadership journey to the next level? Book a discovery call free at transforminghealthcarecoaching.com to explore our personalized coaching packages designed specifically for healthcare professionals like you.